Dentistry is slowly making the shift kind of to the way that medicine provides care as well. So instead of looking at past destruction, looking at things like x-rays, which are still beneficial, I don't want to be quoted as saying they're not, we need x-rays, but instead of just looking at past destruction or lesions that have already happened or things that are already going on, and we can also incorporate these things like knowing our oral microbiome, doing salivary testing, seeing these early signs of disease and actually treating disease. How great would it be before it causes destruction? Not just saliva and water. There's things in our saliva that we need to know about that need to be there to help us have a healthy oral cavity. There are ways we can test this, and this is just one test, but there's ways that we can test for these different components in our saliva. And with this test, we can test resting saliva flow, stimulated saliva flow, which are both important. This is measured in the stimulated saliva flow, and it helps us know if there's available bicarbonate and proteins to help buffer the acid attacks. This helps protect the tooth from demineralization. It's a simple test that you do with the saliva, and it gives you a score reading, and it's actually set up so the patient can see the score reading, and it has the colors green, yellow, and red, because as patients know, green is good, yellow is something we want to watch, and red is a not so great situation. So knowing someone's buffering capacity is really important in knowing their risk for developing decay. Dentin will start to dissolve at 6.7. And there's things that when we know this, we can help our patients with. So recommending, high fluoride toothpaste, baking soda, either added to their toothpaste or as a rinse when after they eat or have acid attacks in their mouth, or when they drink those sports drinks that really lower their pH as well. Utilizing xylitol, all of those things will help patients keep their pH normalized. But if we don't test and we can't show them, then we don't know these numbers to help themselves. Another test that helps with caries risk detection is the ATP bioluminescence. By testing that, it's an indirect measure of how much organic material or residue or food is in the oral surfaces, and then how much potential for growth they have, and whether or not they're going to be able to produce acid. So we want to continually be looking at the saliva, determining if it's protective, if it can help, assessing and managing their risk for caries. So again, is their ATP number high? How do we manage that? If they have high risk, why? What can we do to help them with that? And then finding patients who are more susceptible to that demineralization, because then they're more susceptible to decay. So if they don't have the buffering capacity, if they don't have the proteins in their saliva that we're testing for, then we know they're going to be more susceptible to decay. And we can use the test to help us know that and help us better provide care for our patients. The things that are protective there in our saliva, the calcium, the phosphate, we even have fluoride in our saliva. We know after we brush with a fluoride toothpaste, there's a time period where the fluoride remains in the oral cavity in the saliva, kind of patient dependent, depending on what other things they do, but that's protective in there. And then those proteins that form that pellicle. So we want to have healthy saliva, good proteins, so that it forms a healthy pellicle. And again, we can test for that to know if that's in the saliva helping them out. So we know gingivitis can progress to periodontitis, but we know it can't be explained just by plaque accumulation. And we've been parroting the brush floss for so many years, but we know now that it's more microbiological factors than just that high accumulation of plaque. Patients who have more gram-positive, so even rods and coccy's, tend to have healthier tissue. They have less gram-negative, and they have more gram-positive. The tissue is healthier. In contrast, someone who has more gram-negative and fewer gram-positive bacteria in the mouth tend to have the periodontitis, the more chronic periodontitis, as you can see from the X-ray here, the bone loss. Moving on to this medical model, it's not going to always just be what's in our mouth that's going to cause a cavity or what's in our mouth that's going to cause a pocket. It's what's going on in our mouth that's affecting your rheumatoid arthritis. What's going on in your mouth that's showing you have signs of diabetes, what's showing that you have signs of other things as well.